just by using mouthwash. And 2 out of 3 Americans wake
Wow.
up every morning and use mouthwash. And 2 out of 3 Americans have an unsafe elevation in blood pressure. It's not coincidental, it's causal.
There are several of you who have kind of talked about some of these newer emerging fields in medicine. And today we've got an amazing, prolific guest, Dr. Nathan Bryan. And so, Dr. Bryan, thank you so much for joining us. When we kick off the new year, everybody's looking at new ways to improve their health, but sometimes we don't really know which way to go. So when we look at molecular medicine, which has slowly emerged and now becoming mainstream, nitric oxide therapy has been used for several different disease states, disease processes, but we're looking at it from a longevity standpoint as well. So if we look at anti-aging, longevity, and I know that you have been involved in nitric oxide research for the past 20 years. And today I thought we could really delve into how you got there, where the science is at, where it's going, and how can we all be a part of it. So I know that you are, president and CEO of Bryan Therapeutics, and why don't you bring us through the history? How did you become interested in nitric oxide therapy?
Yeah, well, thanks, guys. It's a great pleasure joining you. And Happy New Year. And we're off to a great start.
Happy New Year.
Just like any career, it's a journey, right? And so the longer I live and look back, I realize, how little control I had over this. And I think God puts people in our lives at different points and we pivot and take on new paths. But, I've always been interested in science and medicine. I graduated top of my class in high school. I went to the University of Texas, got a degree in biochemistry. And then from there, I realized that a bachelor's degree in biochemistry really was going to get me where I needed to be. So a couple of years thereafter, I went to LSU School of Medicine, where I enrolled in a PhD program in molecular and cellular physiology. And really looking back, a degree in biochemistry and a PhD in molecular and cellular physiology really gives me a kind of the background of really how to understand the mechanism of human disease to the extent that we can fix it. And then from there, I trained in Boston at Boston Medical Center and the Whitaker Cardiovascular Institute, really studying kind of cardiology, vascular biology. And then I'd had my first faculty position. I was recruited by Fred Murad, one of the gentlemen who shared the Nobel Prize for the discovery of nitric oxide at what was called the Institute of Molecular Medicine. And our focus was to understand the mechanism of human disease to where we could develop rational therapies. And that really put me on this very narrow lane of nitric oxide. We knew that nitric oxide was extremely important. It's a gas that's produced in the lining of the blood vessels, and once it's produced, it's gone in less than a second. And it controls a number of important physiological processes like control of blood pressure and blood flow and inflammation, oxygen delivery, and it's basically how our body heals. It's part of the regenerative process of humans. So the challenge when I started in this field 20 years ago was we knew nitric oxide was important, but how do you develop safe and effective nitric oxide-based therapies? How do you recapitulate the production and the signaling of a gas once produced is gone in less than a second? And that was really the basis for a lot of my discoveries. We published a number of seminal papers. And so today, fast forward 25 years, we have the first and only solid dose form of bioactive gas. So we've productized a lot of these discoveries. We make nitric oxide products that actually, if your body can't make nitric oxide, then we do it for you. We've done this in
Wow.
a dissolving lozenge. We've done it in topical for skincare, really important in plastics and aesthetics and regenerative medicine. And now we have technology that we're moving through the FDA for specific FDA drug approval for things like ischemic heart disease, Alzheimer's, topical drugs for diabetic non-healing wounds.
We say that it's involved in healing regenerative processes and things like that. How does the body make it, first of all? Where's the most common area that it's used, do you think? Well, why don't you answer those two first, and then we'll kind of go into what you were just talking about as far as the only solid form.
Well, today we have a very clear understanding that there's two primary pathways the human body makes nitric oxide. There's an enzyme called nitric oxide synthase. It's found in the lining of the blood vessels called our endothelial cells. And that enzyme, if it's functional and coupled, it's responsible for the second-to-second regulation of blood flow to every organ, tissue, and cell in the body. It maintains clear blood vessels. When you lose the ability to make nitric oxide, you start to get inflammation, oxidative stress, and immune dysfunction. You get platelets that start sticking, and We call that microvascular inflammation, the earliest stages in the onset and progression of cardiovascular disease, which, today remains the number one killer of men and women worldwide.
Sure.
So we understand now the enzymology and the biochemistry of that enzyme. We know what causes it to become uncoupled. We know how to recouple it and restore its function. That's the first pathway to be discovered. The second one was relatively recent. About 20 years ago, we and others discovered that the bacteria that live in the crypts of the tongue, the oral microbiome, are there to provide a source of nitric oxide that we get from diet. So, for instance, this explains like a Mediterranean diet, the Japanese diet, a plant-based vegetarian diet. All the cardioprotective benefits of diet can be explained by this mechanism of utilizing inorganic nitrate, the bacteria converting that into nitrite and nitric oxide, and it's vasoactive, and it can compensate for a loss of endothelial nitric oxide production. So our whole focus, really starting 20 years ago, was understand how the human body makes nitric oxide, what causes people to become deficient, and then once we understood mechanistically those two, then we could develop rational therapies to completely recapitulate nitric oxide production, nitric oxide signal.
Well, you were alluding to this earlier. Because nitric oxide is fleeting, it's there and it's gone within a second. Obviously, our first answer to most things is we take a supplement. And obviously, it becomes a little more difficult when it comes to nitric oxide therapy. Before you had this first solid form, what were we resorted to using? This was inhalational, again, looking at therapeutics. So let's say someone comes in, they're completely healthy, and they're looking for potential longevity, versus someone who comes in and they have the beginning stages of cardiovascular disease, some plaque formation, things like that. Both of these, I feel now, are scenarios where nitric oxide therapy can be potentially useful. How would you explain the two different scenarios?
Well, I think let's go back kind of 20 or 30 years. The first indication, the FDA-approved indication for nitric oxide therapy was inhalative nitric oxide therapy. And the only approved indication was in the neonatal intensive care unit. So these are premature babies born with pulmonary hypertension. So the only effective therapy was to give them inhaled nitric oxide, which would dilate the pulmonary arteries, reduce pulmonary pressure, and then match the ventilation to perfusion that you see in patients with pulmonary disease. This has been utilized now for 30 years in the neonatal intensive care unit and saved hundreds of thousands, if not millions, of babies' lives. Now it's used off-label in coronary bypass surgery to maintain, the cardioprotection during cardio bypass surgery, and you can use it off-label for pulmonary hypertension. The problem is when you turn the gas off, you see an increase in pulmonary pressure, so it's not sustainable. So what we've done is really, I think, going to move the field forward, because now we have a sustained release of nitric oxide, that we can release nitric oxide that has endocrine functions. We published a paper in 2007 showing for the first time that nitric oxide was a hormone. So now we can give nitric oxide and it really allow its endocrine effects to take hold. So going back to the question, I think, and it's a very good question, because there's two populations who I think could benefit from nitric oxide. There's the people that are sick and tired of being sick. And then there's the people like us who are still relatively young and healthy who don't have disease. But in that case, we need to take it proactively, prophylactically, to prevent this age-related decline in nitric oxide. So it's really, I think, it's attractive for everybody, because I think, as you guys know, it's much easier and more cost-effective to prevent disease than it is to treat it once you have it. And that's the beauty of nitric oxide. We can be proactive and get this in the hands of people all around the world, prevent the loss of nitric oxide production. And the science tells us that if we can prevent the loss of nitric oxide production, we can prevent a lot of age-related chronic disease.
Speaking of chronic diseases, and you had mentioned it earlier, we're looking, obviously, we see the cardioprotective effects and we know where it's a benefit there. Obviously, we're looking at major organs like liver, kidney. The effects of nitric oxide therapy are essential. You had mentioned something about skin, and that's where, listen, you get a plastic surgeon excited when you talk about potential therapies for the skin. And again, it may seem very shallow, but obviously, the skin is a direct reflection of what's happening on the inside. And so it's the largest organ in the body, blah, blah, blah. But at the same time, we're looking to improve the effects of using some of these therapies internally. Now, shed a little more light on what's happening externally. So when we use nitric oxide therapy for the skin.
Yep. Well, you brought up a very good point. The skin is an organ, just like the heart or the sex organs, right? And when you don't get enough blood flow to any organ, you develop end organ disease or dysfunction, right? So just like erectile dysfunction, if you can't dilate the blood vessels of the sex organs, you get erectile dysfunction. If you lose the vasodilatory capacity of the coronary arteries, you develop coronary disease, ischemic heart disease. If there's compromised blood flow and microvascular dysfunction in the skin, which by the way is an organ, then that organ fails. And what does that look like? Well, you lose collagen, you lose hydration, you get inflammation, you get age spots, you get acne, bacterial overgrowth. So our whole approach was, look, we knew from the clinical literature that if you could improve nitric oxide through the coronary arteries, you could overcome ischemic heart disease, dilate the coronary arteries. If we could create a topical nitric oxide, could we open up the microcirculation, recruit capillaries, dilate blood vessels, superficial blood vessels, improve perfusion, and then lead to better collagen deposition, better hydration, and reduction in inflammation? And if we could do that, would that lead to better overall the look, tone, texture, and clarity of the skin? And the answer is yes. We've got 5 published peer-reviewed clinical trials on our topical that does just that. So again, if your body can't make nitric oxide, we do it for you. Now, the limitation to that is because we're producing nitric oxide gas, there's a limit of diffusion of NO gas into the tissue, maybe a couple of millimeters. So if you're dealing with superficial blood vessels, small blood vessels, microcapillaries, then yeah, it's very effective, but it's not going to penetrate far enough to dilate, resistance arteries in the skin. And I think that's probably an important consideration because you don't want to apply a topical and lead to an unsafe drop in blood pressure.
Definitely. It almost sounds, when we talk about skin and applying nitric oxide, I'm imagining it's in a cream or ointment therapy. Now, because of the half-life, are we concerned about short acting? Will there be a long-term effect, or does it have to be something that you would place multiple times a day? And is there a kind of a dilating effect where you look a little red when you're placing this?
Yeah. No, it's quite remarkable. It's a great show and tell because, as you guys know, most skincare and beauty products are designed to mask or hide the effects of aging, hide the fine lines and wrinkles, hide the age spots. What we do is completely different. In order to do this, I had to make a dual chamber delivery system. So you take one pump from each side, it's the dual chamber delivery. And then once you mix these together in the palm of your hand and apply it to any part of the skin, it activates the nitric oxide. And so you'll actually see the skin turn pink. And that's a hyperemic response. We're forcing blood flow to wherever you apply that. So we haven't magically changed the physical chemistry of nitric oxide. We're generating nitric oxide gas, but all of our clinical trials are using the serum once in the morning, once in the evening. And usually after 30 days, we see transformative results. So to answer your question, and our technology does 2 things. Number one, it produces nitric oxide. But we also restore the enzyme. We recouple the enzyme in the lining of the blood vessels. So we're improving the body's ability to make nitric oxide on its own. So it's not just like a quick therapy, and it's completely unlike, hormone replacement therapy. For instance, if you give testosterone, you shut down endogenous production, right? What we do with nitric oxide, we didn't want to do that, right? It's a great financial model, right? Because now you become dependent upon it, but it's not a great physical model. So what we want to do is we want to give the body what it needs, recouple that enzyme, and now lead to better endogenous production. So it's just like now we're figuring out if, okay, usually applying it twice a day is sufficient for seeing changes in what we call these non-surgical kind of rejuvenation procedures that are really becoming more mainstream.
And let me ask you as a follow-up to that, do you think this eventually will be a vehicle for a delivery system? Meaning, let's say you take actives and you mix this with something that improves the depth of penetration or allowing the active to be taken up by some superficial blood vessels. I wonder if a high concentrated vitamin C or, if you were to take small amino acids like proline and lysine, it would be interesting to see if you provided more of these essential nutrients for collagen production, nitric oxide could be a delivery system.
No, absolutely. The nitric oxide itself. So one of the chambers contains 20% vitamin C. So when we do this, we're providing a high dose, high potency vitamin C, but we've done biopsies and we can actually see collagen deposition and improvement in collagen formation just from applying the nitric oxide. So I think this whole concept of give the body what it needs, the body does its job. We just got to get out of the
Sure.
way. So if we deliver nitric oxide and basically just open up the capillaries and allow better delivery of the amino acids, of the raw material, of the nutrients that it needs to do its job, then the human body typically doesn't make mistakes, right? It's a lot smarter than we are.
Right. Yeah, you're right. You're right. Despite what we do to it, it still manages to move forward. So, I always think about that after like a New Year's Eve.
I noticed that we didn't talk about something. You have a book that you wrote a couple of years ago called The Nitric Oxide Solution. Is a lot of what we're discussing today in the book, and a lot of because I know there are ways that we can actually actively increase nitric oxide production without taking any supplements, without doing anything. Does this book really give us that handbook? And can you tell us a little bit how you came up with this book?
Yeah, well, that book I published, I think back in 2010, 2011. My latest book is called Functional Nitric Oxide Nutrition. It's probably 3 years old. I've
Okay.
got a book now that'll be out probably in the next 90 days called The Secret of Nitric Oxide, Bringing Nitric Oxide to Life. And that's going to be the most up-to-date, comprehensive kind of, because, the field of nitric oxide moves so quickly that what we understood and knew 10 years ago is completely different than the understanding we have today on how do we, improve nitric oxide production. But yeah, you make a very
Congrats.
good point. So my whole objective is to understand the science to the extent that we just can improve our own nitric oxide production without drugs, without supplements, just give the body what it needs, right? And so today we understand that there's things that we do that completely shut down nitric oxide production, that it's completely unbeknownst to people that do it. So number one, we found that people who use mouthwash every day that kill the oral microbiome, it shuts down their nitric oxide production. We published in 2009, it causes an increase in blood pressure. You lose the protective benefits of exercise just by using mouthwash. And 2 out of 3 Americans wake
Wow.
up every morning and use mouthwash. And 2 out of 3 Americans have an unsafe elevation in blood pressure. It's not coincidental, it's causal. The same thing with fluoride. We have to get rid of fluoride because fluoride's an antiseptic. It kills the oral microbiome. And most people are using fluoride in their toothpaste. It's a neurotoxin and it shuts down your thyroid function. And then the other issue are proton pump inhibitors. These antacids that 200 million prescriptions are written for every year, and that's not even counting the over-the-counter purchases. Now we know that PPIs completely shut down nitric oxide production.
Wow.
People who've been on PPIs for 3 to 5 years have a 40% higher incidence of heart attack, stroke, and Alzheimer's.
Wow.
So if you just stop using mouthwash, get rid of fluoride, and get patients off antacids, specifically PPIs, then now their body can actually produce nitric oxide on its own. Now you throw in, some more green leafy vegetables, moderate physical exercise, 20, 30 minutes of sunlight a day, and voila. Now our body's primed to make nitric oxide on its own. So we just got to get out of the
Wow.
way. Stop doing the things that disrupt it, start doing the things that promote it. And it's really that simple. The science is very complex, but the solution is really simple.
And what's the story with the beets?
Beats hit the radar probably in 2012 in the London Olympic Games, because at that time there were probably half a dozen clinical studies showing that people who consume beetroot juice, which contain nitrate, their body could convert it to nitric oxide and improve exercise performance. So now then beets became this hero vegetable. But I've tested almost all the beets on the market, including beets you buy at Whole Foods or retail grocers, and 99% of them don't contain any nitrate and don't provide any nitric oxide benefit. So there's a lot of consumer deception and fraud going on by these companies trying to sell you beets and chews or gummies and all this crap that really have no way to deliver nitric oxide. So, but
Right.
we've actually been able to harness the benefits of beets. So we know the agronomy, we know kind of the nitrogen cycle, and we ferment our beets. We provide a beet product called NO Beets. Number one, that doesn't look or taste like beets. We take all the oxalates out, so no issues with kidney stones. It doesn't taste like beets. We make it a sweet berry flavor, and we add electrolytes and mitochondrial ATP to it. So it's actually a great beet product that enhances performance, improves energy, and it's called NO Beats. And that's an incredible product, not because I made it and formulated it, but just because it's, we position it to be a pre-workout or to replace things like Red Bull, 5 Hour Energy, all these stimulant-ridden, really dangerous energy drinks that most people are drinking. So we want to
Yeah.
provide a natural energy source.
That's great.
You had brought up, you had just mentioned nitrates and the ability to convert to nitric oxide. And from my understanding, listen, there are several products on the market that we want that to be nitrate free because nitrates were associated with gastric cancers and esophageal cancers and things like that. How can we differentiate the goods and the bads when we talk about nitric oxide producing, foods?
Yeah. Well, there is no distinction, and maybe surprising to your viewers, but the media in the scientific community hasn't always been honest with us. And what we believe, again, in the 50s and 60s of what we thought are completely different than what we think, 60, 70 years later. So this whole concept of nutritional epidemiology started in the 50s and 60s, specifically as it related to nitrate, nitrite, and nitrosamines. So you always start with important observations, clinical observations, then try to work backwards and figure out the mechanism. So there were data appearing that showed that nitrite-cured meats, there was a slight increased risk of gastroesophageal cancers. So in the field of nutritional epidemiology, we call this associations, right? There's an association between exposure of certain things and certain disease process or outcome. But it doesn't implicate causation. It doesn't necessarily mean that causes the disease. There's just an association. So their biologically plausible mechanism 50 years ago was nitrate and nitrite can form nitrosamines. Low molecular weight nitrosamines are mutagenic, carcinogenic agents that can intercalate DNA, cause mutations, and cause cancers. That was the theory. But if that were the case, and then fast forward, 30 years where we entered the picture, and we revealed that 85% of the nitrate that we get from our diet comes from consuming vegetables. Only 5% comes from consuming cured and processed meats. The other 5% comes from swallowing our own saliva, or other 10%. So if nitrate and nitrite cause cancer, vegetarians would have a 10-time higher cancer rate than meat eaters. And we know it's just the opposite. So now their biologically plausible mechanism falls apart. I don't dispute the slight increase in relative risk on, bacon, hot dogs, cured and processed meats, and certain gastroesophageal cancers. I never argue with the data. It's the interpretation of the data. But there are other things in those, like heterocyclic amines, that may be mutagenic. But my point is that nitrate and nitrite are anti-cancer molecules. They're not cancer promoting. In fact, we published, I think in 2009, that you can actually prevent the onset and progression of cancer and even metastatic disease with nitrite and nitric oxide.
Yeah, I think a lot of people don't understand the difference between epidemiologic studies and causal studies. And so that's why the supplement market just booms. It's through the roof. We look at one huge epidemiological study and it'll show that this leads to increase in energy and decrease in negative things. But to have an association, that same study could say, all right, well, everybody who eats margarine, gets a divorce. It's crazy, and I've seen that study. When you look at, we had Paul Saladino on, who's the carnivore MD, and he talked about it. He brought up a study where it showed the association between, green leafy vegetables and someone was living longer, but the same study had that outcome. It was that all of the relationships that they had in excess of margarine, they all developed divorce. He was just joking, but it was a true association in those studies. Whereas a cause and effect study is so much more powerful to isolate, particular substances. So
I think those observations and those associations are important because it gets us a starting point. And then as scientists, basic scientists, we work backwards and then try to figure out mechanism. Because until you can figure out mechanism, you really don't have a clear understanding of what's going on. And if you don't know what's going on, how in the hell can you fix it? So that's been our approach in terms of specifically as it relates to nitric oxide.
I have a question for you relating our field, and you brought this up a little bit. So it's kind of a twofold question. Patients that are undergoing just routine plastic surgery, would you recommend us to pre-treat and post-treat them with nitric oxide supplementation? Because it only makes sense to me. You're bringing excess blood flow to the area, so therefore you're going to have them heal better. That's the first question. I'm going to actually pose the second question to you, and you could just answer both if that's okay with you, is what if you run into problems? For example, and I'm just going to throw this out, I do a lot of breast surgery, and you have decreased blood flow to a nipple. That nipple getting, a little bit of necrosis, or even just any skin flap. You're doing a major DIEP flap, or you're moving one. You think that there is a role for nitric oxide to be used to allow more tissue oxygenation, more blood flow to tissue? It may be a long shot, but I figured I'd ask.
No, absolutely. I mean, I think it's critical because what you're doing in surgery is you're creating a wound, right? You're fixing things, but you're creating a wound. And wound care is all about the ability of the body to produce nitric oxide, restore blood flow. And if you're cutting blood vessels and then restoring blood flow, you get this concept called ischemia reperfusion injury. My first idea in nitric oxide-based therapeutics was in donor grafts. Because when you take an organ from a donor and then you transport it and transplant it in a recipient, that organ's been without blood supply for many hours. And then when you reconnect it, there's this paradoxical reperfusion injury. And we discovered and published this, I believe, in 2004, that nitric oxide completely inhibits that ischemia reperfusion injury. So if you pre-treat the patient or the organ with nitric oxide, and then when you do the surgery or initiate the wound, then the repair mechanism is all in place. We can restore blood flow. The tissue oxygenation is dependent upon nitric oxide. And mechanistically, the oxygen delivery by hemoglobin in the red blood cell is dependent upon nitric oxide being bound to a single cysteine residue in that hemoglobin. So the oxygenation of tissue and the restoration of blood supply to any tissue, whether it's a nipple that's gone without perfusion for a period of time that's becoming necrotic, if you can restore blood flow to that, then you can, rescue that tissue. So to make a long story short, I think in what we're finding, we've got a lot of, regenerative medicine clinics, plastic surgeon derms that use our nitric oxide pre and post treatment because they're getting better outcomes. If you've got a patient that's smoking and has a number of comorbidities and you do surgery on them, their outcome is not going to be great. They're not going to. So if we can kind of level the playing field in terms of nitric oxide by pre-treating these patients with our nitric oxide, now any type of injury or wound that you perform through the surgery is going to have better recovery. Now we're finding the topical, whether it's the recurrence of surgical site infections or just scar remediation. If you apply the topical to that, it's antibacterial, so you reduce surgical site infections and you prevent better healing and mitigate the scar formation. So everything we know about nitric oxide, I think, is extremely applicable to aesthetics and plastic surgery.
Great, thank you.
When we look at the practicality, so let's say for all the physicians listening, how do we get our hands on it? And then for all the patients listening, what should they be asking for? I think the pharmaceutical companies did it best. They put on all the ads on TV and said, ask your physician about it just to help promote. But if we're not educated enough, we just simply don't know. So from the physician standpoint, what can we do? What do we reach out? How do we get our hands on some of these therapies? And for a patient, what should they be asking pre and post surgery?
Yeah. Well, my objective early on, once we understood the importance of nitric oxide, was to develop safe and effective nitric oxide products in every major category around the world. We've done it in nutrition, dietary supplements. We've done it in skincare and topicals. Now we're moving this through FDA. So kind of the qualifying statement is none of the products we have on the market today are designed to prevent, treat, or cure any disease. So these are so-called dietary supplements and skincare products. But they're available through n1o1.com. That's the letter N, the number one, the letter O, number one.com. We have wholesale pricing for physicians. And then for consumers, because there's so much confusion. I've been doing this for 20 years and I see commercials and I see ads and, even I'm confused because you've got companies out there trying to sell you nitric oxide products that there's no way possible based on the scientific understanding that these products can produce nitric oxide. But yet it's a $1 billion industry and people are buying these products. Yep. So buyer beware. I encourage people to get educated, get informed. But again, if you're interested in safe and effective nitric oxide products that is based on real science, the guy who's actually been in the lab discovering the science, innovating, and creating the technology that's still running the company, then those are our products. But ask for, does the product actually produce nitric oxide? Are there any clinical trials published on it? And you have to be able to demonstrate that this product works. And that's what we do. If we can't demonstrate that it produces nitric oxide, we don't bring it to market. So every product we do, we can show it produces nitric oxide. We see biological effects. And that's our metric. And there's no other company out there that does that, although they'll promise you the moon and stars, but there's no science behind any of their products.
If you look at true data and right now, looking at nitric oxide therapy, because we know that some of these products will increase the level of nitric oxide. It's cardioprotective, it's organoprotective, really. And how does that translate to, do we have any current studies that are out there that relate to surgical outcomes that we can say, look, this is what we recommend, this is why we recommend it, and here's the data to prove it? Or are we still working on that?
In surgical, you guys appreciate, it's very difficult to do a controlled, randomized, placebo-controlled study in surgery. I mean, what do you focus on? Do you look at orthopedic cases? Do you look at plastic cases? What's the objective endpoint?
Sure. Is it the incision? Is it the
That's right.
The end yeah, I mean, there's so
So
many
we're doing
variables.
that now. We've got some studies with a group of podiatrists that are doing nerve decompression surgeries with some scars, and we're treating half the scar with our topical, the other half we're not. It's not double blinded, because the patient knows
It's
which
too hard.
one.
Yeah, it's too hard to do that.
But it's giving us some objective measure. So to answer your question, there's not, but we're moving, we've got drugs that we're moving through clinical trials for ischemic heart disease. We're in phase 3 clinical trials now, and what we're doing now is just seeing if we can prevent or delay exercise-induced angina in patients diagnosed with ischemic heart disease. A 30-day study showing no tolerance, the FDA will approve the drug. We've got a drug going into Alzheimer's drug studies, and we're looking at objective endpoints like cerebral blood flow with functional MRI, SPECT scans, and looking at cognition. Remarkably, nitric oxide addresses every single aspect about Alzheimer's disease. It improves cerebral blood flow, it improves glucose uptake, it addresses all the aspects of the metabolic components of Alzheimer's disease, and we've seen really an enormous clinical effect and benefit of that. And then topically, which is relevant for you guys, we've got a drug going into clinical trials for non-healing wounds and diabetic ulcers. There's been no innovation.
That's the easiest market right there for plastic surgery. You get into a non-healing wound.
Yeah, we treat wounds the same today as we did 50 years ago. Negative pressure, hyperbaric oxygen. Basically, that's a little bit of collagenase to clean up the wound. But nitric oxide, it's antibacterial. It kills the infections in most non-healing wounds, causes a hyperemic response. You get tissue granulation, and the wound heals itself. We haven't seen a single non-healing wound that the nitric oxide topical hasn't been able to heal.
Wow. Okay.
That's great.
Listen, that's
wonderful.
great for all the plastic surgeons that are potentially listening, or all those treating wounds. Let that resonate, because he's right. For decades, we've been saying, all right, non-healing wound, diabetic ulcers, things like that, let's send them to hyperbarics. How long before we see this as mainstream treatment? I know we're slowly moving into that, but how long in reality, according to the FDA, can we see some of these drugs be implemented?
Well, I think we've had pre-IND meetings for all of our drug indications. We know the regulatory path forward. We have full regulatory guidance from the FDA. I predict that we'll move our ischemic heart disease drug. I predict we'll either have that drug approved and on the market by the end of this year or the first part of next year. The Alzheimer's drug is probably a 2 to 3 year project. The topical drug for diabetic non-healing wounds is probably 1.5 years away. But here's what I know. Here's what the science tells us, that there's really not a single clinical indication where nitric oxide at the right dose at the right time in the right patient wouldn't be beneficial. Because when you look at the hallmarks of every chronic disease, there's 4 hallmarks. There's low blood flow, which we call focal ischemia or hypoxia, decreased blood flow to the affected organ. There's inflammation, oxidative stress, and immune dysfunction. In nitric oxide, that single molecule addresses all 4 of those. It dilates the blood vessels, improves perfusion of the tissue, it reduces inflammation, it prevents the oxidative stress, and inhibits the immune dysfunction that we see in chronic disease. So for me, being in this field for 25 years, I think it's the future of medicine. It's how we're going to treat patients for the next 100, 200 years. And it's
amazing.
The beauty of it is it's a concept called restorative physiology. We don't employ the principles of pharmacology. I haven't synthesized a synthetic compound that's inhibiting a biochemical reaction. We're basically replacing what the body normally produces. And that's restorative physiology. We give the body what it needs, the body heals itself. And the beauty of that is there's no side effects, right? This is a naturally produced molecule. And if you listen to the drug commercials, a 40-second commercial is 30 seconds side
Some of
effects.
the side effects of it. So where would you begin just for the average listener?
Well, I'm the all-important N=1 experiment, right? I'm always the first guinea pig. Before we recommend anything,
Funny.
I
Love
take
it.
it and experience it myself. And so those interested in anti-aging and longevity, if you look at the objective measures of longevity, what is it? It's telomere length, right? The telomeres are the ends of the chromosomes, shorter telomere, shorter lifespan. It's stem cell function. How well can our own stem cells mobilize and differentiate to repair and replace dysfunctional cells? And then it's mitochondrial function. Nitric oxide prevents telomere shortening. It induces mitochondrial biogenesis, and it's the signal that tells our own stem cells to mobilize and differentiate. So what I tell people is nitric oxide is foundational. It should be where you start because nothing else you do is going to work optimally until you restore the function of nitric oxide. Now, it's not going to fix if you have hypothyroidism. Nitric oxide's not suddenly going to fix that. You have to dig a little bit deeper. If you're deficient in vitamin D, nitric oxide isn't going to fix that. But what I can tell you is nitric oxide is foundational to where if you're supplementing with vitamin D or taking any type of hormone replacement therapy, it's going to get better delivery to the target tissue if you have good vascular flow, good perfusion, good patent blood vessels that allow for the delivery of oxygen nutrients to every organ, tissue, and cell in the body. So that's foundation. And then I tell people, look, stop using mouthwash, get rid of fluoride. If you're on antacids, get off antacids, eat a balanced diet in moderation, exercise, and get some sunlight. And it's really that simple.
If you like this video, you're going to love this one.
Enduring memories is this older gentleman coming in a walker, just shuffling, really, pained, makes it to the treatment room. When I see him walk out, his son is carrying his walker and he's just walking.